So we're going to get through our statements first and then go into a question and answer session afterwards. We're going to start off with Dr. Silvernail from the Public Health Department.
Good morning, fellow Pitt County residents, response partners, members of the media. This morning, we have added 4 new cases to our county case count. At least 2 of these individuals are known to be young and doing well. They remain at home in isolation. The other 2 reports I received literally as I was getting on the elevator to come up to the press conference, so I have no details about them at this time. Pitt County Health Department communicable disease staff will be conducting our interviews today with those individuals, and we will report more details at the next briefing. Our thoughts and prayers are with our affected residents, and we wish them a speedy recovery. I'd like to take a minute to review how this virus spreads. Mostly the spread is by what we call respiratory droplets. In plain English, that means coughs and sneezes. Respiratory droplets in general do not travel more than 4 to 6 feet. This is the basis of our 6-foot separation recommendation. Contact, this means the virus on different surfaces, and in this there's still a great deal of dispute. The estimates vary widely. Dr. Tilson, the state health director, has said 3 to 6 hours. I and Dr. Ramsey, the chairman of the Pitt County Board of Health, have said 6 to 8 hours. Some sources report shorter times. Some sources report longer times. There are some reports that this virus can be found on paper and cardboard. I would caution folks in interpreting those reports that just because it can be found on something does not mean that it remains active or infectious on that surface. This is the basis for our frequent hand washing recommendations, so that if you have come in contact with it on a surface, you can remove it from your hands promptly and before you have a chance to infect yourself with it. Our case counts currently in North Carolina, and this is from the DHHS website, 504 cases. North Carolina deaths as 2. I know or 2. One of those is a resident. One was a resident of Virginia who died in North Carolina. In Pitt County, we have 8 cases with no deaths in Pitt County at this time. Our update on testing status. We have currently, or we are aware of at the Health Department, 174 tests that have been done in Pitt County. Of those, 10 have returned positive, 68 have returned negative, and 96 remain pending as of this time. In closing, I would encourage you, to the extent possible, to go home and stay home. Do it for your loved ones, do it for our community, and do it for yourself. Thank you.
Good afternoon. I'm Brian Floyd with Vitan Health to give you an update on the work that we're doing. First, let me say to all the team members at Vitan Health how proud I am of you, and thank you so much for your dedication to Pitt County and all of the region that we serve, particularly here at Vitan Medical Center. Our teams are just doing an outstanding job, and their passion for healthcare in this community shows at a time like this as none other. I'm also proud of the community for its outpouring of support. Your calls and your ask of how you can help are so very important, and we certainly do appreciate it. We continue to develop and implement our escalation plans and readiness as this COVID virus continues. Our teams are escalating today with even the use of masks inside the hospital environment. We are following CDC guidelines for the best practice way in which you can lessen the curve, which is our total effort at this time. The best treatment and management of this virus is to reduce its spread, and reduce its spread consistent with your capacity to manage the patients. And that's what we're seeing in other markets and other hospitals around the country, and the COVID virus is not behaving differently in Greenville than it is in other markets. So we all have to be diligent, to go home, stay home, and help us make sure that we have the ability to care for this region in our hospitals by reducing the spread of this virus. Our hospitals are also, when you feel the need to see a doctor or you feel sick, we're asking you, if you are sick enough that you would normally call your doctor, to do so. And if you feel the need that you have to go to the emergency department, we're asking you to call first and let us know you're coming, whether it's an urgent care environment, physician practice, or the emergency department, so that we are ready for the patients when we come. But if it's not necessary, please stay home and treat yourself at home. Our hospitals are appreciative of all the support from the community. If you want to support in some way, we have a mechanism to receive that support and help manage that outpouring. And we would ask that you call the Vitan Health Foundation, or you can reach us at vitanhealthfoundation@vitanhealth.com. Thank you.
Rick Owens with Pitt Community College. Students, PCC is asking your assistance with the Go Home, Stay Home campaign to keep our community safe. As you've heard today from Dr. Silvernail and Mr. Floyd, for your safety, the safety of your loved ones, the safety of our healthcare teams working tirelessly on the front lines, the best thing everyone can do is stay home. As of 5 p.m. yesterday, Pitt Community College closed to the general public. A limited number of staff will continue to ensure operations are running smoothly, and the vast majority of PCC services are now available either by telephone or video conferencing. PCC understands that this is a trying time for many of the people concerned. We're doing our part to follow social distancing guidelines and keep the campus community healthy. Though campus access is restricted, we'd like to emphasize that PCC is still assisting students with completing courses and working towards graduation. Advising, career services, counseling, tutorial services, and many other necessary student services are available by telephone and video conferencing. Speaking of graduation, this year's ceremony will not be held in person. It'll be offered in an alternative format, probably online. Additional details will be available as soon as they can. For students that are having difficulty with coursework due to technology, please review the student resource page on our website for COVID-19. We do have resources available to assist. PCC will make an announcement regarding continued operations on April 3rd. We're asking students and employees to continue to monitor your email accounts and the PCC website. I'd like to reiterate again that PCC is encouraging our students and employees to go home and stay home. The faster we can flatten the curve, the faster we can get back to normal. Thank you.
Good morning. I'm Sergeant Lee Darnell with the Pitt County Sheriff's Office. I bring you greetings from Sheriff Paula Dance. The county and the Sheriff's Office have both received many calls from citizens curious as to whether they need documentation during their travels about the county. We have not been, and we do not plan at this time, to stop vehicles or pedestrians to inquire as to whether their reason for travel is legitimate. At this point, the only time that we may address that is if we find a group of citizens congregating in public. And even at that, it would be an act of education for their safety and not an enforcement act. The sheriff does hope that our citizens will be responsible, that they will pay attention to the directives of the state, the county, the cities, and of our healthcare providers, and that they will go home and stay home to help this crisis pass more quickly. With that being said, this is in relation only to actions of the Sheriff's Office, as I cannot speak for the various municipalities and their police departments. Pitt County, we pray for your safety and your wellness. Thank you.
Those are all the prepared statements we have. We'll now open it up for questions. Keep in mind, we have many community partners represented here, not just the ones that have spoken already. So if you have any questions from anyone that's presented here, we can go through that. But we're going to start off with Dr. Silvernail.
Hello again.
Oh, okay. Can you give a status of, you kind of did earlier, has there only been one hospitalization so far, or have any other patients been hospitalized?
To my knowledge, there are 2 Pitt County residents in the hospital.
Okay. And you said 2 of the patients are young people. Are any of them ECU students?
We had one person who was an ECU student who returned from Florida and was never on campus. That was positive.
Okay. And I think that, okay, I think.
Hello.
Good morning.
So I just wanted to ask, I know that different towns and cities are making their own decisions as far as stay-at-home orders. Anything you have to say to that to maybe encourage, or what do you have to say to them making their own decisions in certain towns not being under a stay-at-home order right now?
Yeah. The more that we can separate ourselves, the harder it is for this infection to spread. And we talked about 6 foot as a distance for respiratory droplets. So if we can temporarily stay apart, I know that's hard. There's a need for human contact and human interaction. But the more that we can stay apart and avoid that contact and keep the virus from spreading, the better off we're all going to be on the other side of this.
And an actual stay-at-home order, how much does that make a difference than not having an order like that?
Well, we're hoping that at least people will heed it because it is an order and instead of a suggestion. As the sergeant said, there's no active enforcement list, at least by the county sheriff's office. But some people, have said, "Oh my gosh, I can't go out because there's an order." So the fact that it's an order as opposed to a recommendation, I think, is going to keep more people at home. But there's still a wide variety of essential services that people are free to access if they need to.
Ideally, is that what you would want each town and city to be doing right now?
I think so. Yeah, I think the more that they can do to, again, encourage that separation of folks to prevent spread, the better off we're going to be through this, and the sooner we get to the other side of it.
Got it. Thank you.
So, Dr. Silvernail, with these 10 cases, I know you just got information or just heard of 2 very recently, but for the 8, can you talk to me a little bit about kind of some of the demographics as far as ages and how they vary with these cases?
We know one person was in their 70s. That's probably the oldest of the cases. The youngest, I believe, is 22, so that's kind of the range on this, Tyler. Most of them were younger adults and have had a mild illness. One of those individuals was hospitalized, but is hoping to be discharged in the next day or 2.
Was that the ECU student that was hospitalized, or?
No, it was not.
Was not, okay. And then, with this, obviously there's been such an emphasis on older adults who really get a lot of the brunt of this virus, but we're seeing a lot of these cases as young people, I guess. What is kind of your message to younger people as far as the severity of what really could happen if they do get the virus?
Well, while the statistics certainly argue that older folks are more likely to have the severe illness or a critical illness from this, there are some young folks who have a significant illness with it. So again, we would encourage them to have proper hygiene, cough etiquette, hand hygiene, those things, and to make sure that they separate, to stay away from folks and not be within 6 feet of people. I think young folks think they're a little bit invincible sometimes. And maybe don't heed the warnings as much as somebody who's a little older.
And for these new cases, are there any groups or areas within Pitt County that people should be aware of as far as maybe where these people have ventured out before they started isolating?
Not that I'm aware at this point. Like I said, 2 of them I received literally coming in the door. So when we have case evaluations of those, we'll have further information for you on that, Tyler.
Okay, awesome. Thank you.
Any questions provided?
Yes.
Okay.
So, just talk to me a little bit about kind of some of the precautions that you all are taking at the hospital as far as PPE and what you're doing in that regard.
So at the hospital, we've been for weeks preparing, obviously, and we have been educating and training our staff. We are doing our own social distancing for well over a week now. We've sent all people that can be working from home. We're doing that and have been doing that for well over a week. As it relates to PPE, today was probably the first day of escalation to masks as people come into the facility. As of yesterday, we have been doing screening of every person that comes into the hospital, where we take their temperature. We ask them a series of questions, whether they're visitors or our own staff. There's only 3 ways to get into the hospital now. When I go to work, I get screened every time I walk in the hospital at this point. And so we're really proud of the screening efforts and how that has played out. And today we put masks in place. They're not mandatory for everyone in our hospital, but we know that the hospital is a high-risk environment for obvious reasons. And we have to also remember that the medical center here in Greenville is the region's resource for patients if they reach a severe level of illness. So our whole hospital system is working as one to manage all of Eastern North Carolina's needs. And so it's really important that the Greenville Hospital in particular and the team that is there are vigilant and hyper-vigilant so that they are here as this curve continues to escalate. I can't stress enough that the virus is behaving as it does in all markets. It spreads, doubling every 2 days. And so we know that we will not see something different as it relates to how COVID behaves unless we change our behavior and we slow the curve coming into our hospital's environment. That's what we're trying to stress. I can't thank the city and the county governments both enough for helping us both protect the citizens of our region and help protect the healthcare workers that are consolidated in markets like Greenville, so they are here to serve Eastern North Carolina. So the escalation is part of CDC guidelines, and we track and measure both our supply of PPE as well as how we're using them very judiciously, and we have a plan for making sure we can manage that.
And I guess give a little clarity is as far as the mask, is everyone offered a mask like when they come in, or how does that work?
Yes, we are encouraging our staff to wear the masks, recognizing that we've limited our visitor policies. Obviously, there are very few visitors in the hospital. It's mostly our workers that are there. And so we're distributing the masks so that they can have a hypervigilance about that high-risk environment.
And there's been conversation across the country about hospitals having that shortage in the PPE. Talk to me a little bit about the supply that you have there at Vidant.
So we have been tracking and measuring our supplies and predicting our future use of supplies on the basis of how COVID requires PPE, how fast you use PPE, and even how we might be able to recycle and use our mask and all those things down the road. So both with managing our supply, our pandemic supplies, and the way we have planned for this, we're confident that we can use our mask in this way. Now, again, it's important to know the best way to minimize the overwhelming use of hospital resources is to reduce the curve. So the more we can do now through all CDC guidelines-based approach to managing the lack of spread of this virus, that is how we can best utilize even our PPE resources by not having an overwhelming curve later as this virus continues down the path.
I know several local businesses are kind of adjusting their operations to actually create PPE, and I know that a lot of them are giving them towards y'all. What is your message for those local business owners and other business owners who maybe have the capability to adjust their operations and provide PPE as well?
We plan for things like this on the basis of what the need is. So with this virus in particular, we have pandemic response teams. One of them is our PPE team that is using both our inventory, managing that, as well as how we can make that last longer, which is both how we use it, how we reuse it, all those things. And there's a group managing the inflow of material from outside the organization where people are donating either PPE or making certain kinds of PPE. We have a process for that to put that in supply later. And so if people would like to help us, and many are, they're finding supplies in a lot of different ways. What we're doing is managing that in a very tight way because we have to know that it's effective if we're going to use it and that sort of thing. So we ask that you use the foundation number I mentioned earlier, Vidant Health Foundation at vidanthealth.com.
And we just heard just recently that there's 2 confirmed hospitalizations here from Pitt County residents. What's the number across all the counties that you serve? How many hospitalizations do you all have currently?
So we are taking care of patients with COVID in 4 of our hospitals right now. The numbers of cases we care for, we are deferring to the state to announce numbers, and that they will move constantly. And so we want a single source of truth for the public as it relates to how many patients are hospitalized or how many patients have the virus. So I would just defer to the county health department for those numbers.
Okay, all right, thank you.
Any other questions? Want to move on to a different? Who do we want to move on to?
Do you have
Oh, you could.
a superintendent?
As he's coming to, we did have a question posed to Dr. Silvernail on our Facebook page about shopping for groceries. He just wanted me to pass along that, standard practices apply. Wash your hands. If you have sanitizing wipes to wipe down the shopping cart, do that, and practice social distancing, and those same practices would apply. Dr. Linger?
Good morning.
Good morning. Just wanted to check in with you. I know, obviously, with schools being closed, that extended into May, and with you bringing on this virtual learning coming up soon, I just wanted to check in with you about that and see kind of how that was going and how many students you all are kind of having to help assist as far as technology and access to the internet.
The exact number of students we're helping with access to the internet, we're still collecting that information. We have started handing out Chromebooks yesterday from most of our schools. We are working on a remote learning because it's not really a true distance learning program. Remote learning could be through books, packets, some online, some not online. So doing a combination of lots of different things. So if hopefully by tomorrow afternoon we'll have everything ready. So when Monday comes around, if parents need packets, for moving forward next week, we will have that information and that available at each individual school.
Shed a little light on some of the obstacles that you all are having to overcome to kind of make this possible and ensure that students get a quality education.
Getting 2 weeks to do it has been a real challenge. But just, schools are people businesses, right? I mean, that's what we do. We work with kids in person. I mean, that's our job. So trying to do anything where we're not doing it face-to-face is a huge challenge. Now, we have started a virtual academy several years ago, so we do have a handful of high school classes that we've been doing virtually for several years. Some of our AP classes are easier to move over to that because they're already created online. Everything else, we're trying to create information and put it online. We have access to lots of different resources that our curriculum team has put together. So all that is moving forward, whether that's iReady or other platforms, Discovery Education, all sorts of different things. Our teachers are creating stuff right now. I've seen the students working and watching their teachers over the last couple of days, just whether that's informally through YouTube or some other means. Be a little more formal next week, and hopefully what we're doing now is reaching out to as many parents and kids as we can to make sure they know what's going to happen start Monday.
All right, thank you.
Anyone else? Any other organizations?
Pitt Community College. Do you still have students in clinical programs?
Very limited.
Okay.
We have pushed through last week to get most of those clinical programs wrapped up. We are still running some programs, public safety and some of the health sciences programs, to get those completed and out into the workforce to assist with this.
So do you still have students in healthcare facilities right now, correct?
I'm not sure. I think we have a couple. They are in, I can't remember what facility they are in, but they're in minimal risk areas.
And are you planning to get their programs completed earlier than intended?
That's the push. I can't say the program's earlier than intended, but we're trying to wrap up that clinical component as soon as possible.
Okay, so what precautions are you taking for these students?
Again, it's the same thing that that everything else is in. You know, if they're in a clinical setting, they're gonna adhere to the healthcare providers' PPE recommendations. The students that are coming to campus, we've got practicing social distancing, staying apart, all of that.
Okay, thank you.
All right, thank you.
Didn't come up for more questions, but Mr. Emery asked me to state the testing numbers for the community. One of our Facebook viewers had a question. So we have had a total that the health department is aware of 174 tests performed in Pitt County. 10 of those have returned as positive. 68 have returned as negative. 96 remain pending at this time. Depends on the lab. We did see some from one lab that were about 3 days in this batch. LabCorp has been running about 7 days. They're staggered as to when they will come back in this group. Okay.
Any more questions, anybody else?
Good. Yeah.
All right, if there are no other questions, thank you all for coming. Once again, I do want to promote that we are putting all of this information on the coronavirus information page of our website at www.pittcountync.gov/coronavirus. That site is also available in Spanish as well at pittcountync.gov/coronavirus-es. All this information will be posted there. Thank you very much for attending today.